Hi, I'm Mary Kay Fitzpatrick. My topic is medical cannabis. I'm going to be discussing the benefits of using it as a treatment for a multitude of disorders and diseases in the United States. To start my discussion, I'm going to talk about how medical cannabis started back in 2000 BC. Originally, it was used by the Egyptians for treating sore eyes and other ailments. About 1,000 years later, India mixed it with milk to use as an anesthetic. Soon after, the Greeks then used it for treating earaches. However, since these are so small for us now, it doesn't seem like a large deal. However, these illnesses were pretty prevalent back then and were not easily treated. Medical cannabis, however, became more well known in the United States around the 1600s during colonial times, where in Jamestown farmers were encouraged to grow hemp. However, later on in 1937, the Marijuana Tax Act completely banned marijuana from being used as a treatment for any illnesses. However, 60 years later, finally in California, it was brought back and it was allowed to be used for treating cancer, AIDS, chronic pain, and other illnesses.
One of the main concerns of medical marijuana are the health effects associated. One study compared tobacco smokers and cannabis smokers to see which had more increased risk for future disease. Tobacco smokers were shown to have an increased risk of emphysema and COPD. When looking at the cannabis-only users, they found that they did not have an increased risk for either of these diseases. Also, they reported to have lower rates of headaches and intestinal issues. However, when looking at mental health, there was an adverse effect of cannabis on the mental state of patients. However, this was seen to be very small. As far as psychosis went, in a different study, they were shown to increase psychosis later on in life. The psychosis showed to have increased suicidal ideation, more positive symptoms, and risk of illness and injury. In patients that already had psychosis and continued to smoke cannabis were at risk for more increased symptoms, hospital readmissions, and absence of remission. It also led to more positive symptoms with them and more continuous illness follow-ups. They're also more likely to relapse and go back to increased violence and criminal behaviors.
Overall, like all other drugs on the market today, medical cannabis does have its negative effects and positive effects. What medical marijuana is mostly known for is its treatment of chronic illnesses, such as cancer, AIDS, PTSD, MS, and other neurological pain or diseases that have long term effects. In conditions such as multiple sclerosis, HIV, AIDS, PTSD, and chronic neuropathic pain, it is shown to improve sleep, reduce pain, and improve overall symptoms throughout all of these patients, and many of the patients began to prefer medical cannabis over their traditional treatments that were given. Medical marijuana is commonly associated with cancer. One study showed that in breast cancer patients in extreme fatal stages were able to use a plant extract of cannabis to stop the progression of their cancer, which is a huge success. And they believe that due to the expression of this drug, that they can soon create other drugs for other cancers that will work just as effectively. There are many public perceptions of marijuana. One of them is how addictive it is. Many people believe that cigarette smoking and cannabis smoking are very similar, that they're both addictive. However, cannabis is not addictive whatsoever, at least in the physical sense. However, there are some psychological addictiveness to cannabis smoking that people get really attached to the feeling of being high or under the influence of THC. However, this addiction is at a very low rate. The second perception is that marijuana is a gateway drug. However, recently found that prescription drugs are more likely to lead to larger drug use such as cocaine, methamphetamines, or heroin. Overall, medical marijuana has the potential to treat many chronic illnesses. However, like some pharmaceuticals, it has some side effects. Some of the side effects are not as severe but still affect the patient in the long term. More research still needs to be done to show the overall benefits and negative effects of medical cannabis.